Breast cancer is one of the most common cancers affecting millions of women and men worldwide. The good news? Early detection saves lives. But are you paying attention to the subtle signs your body might be giving you? From changes in the breast's shape to unusual pain, these signs could mean the difference between early treatment and a late-stage diagnosis. In this video, we'll uncover 9 early signs of breast cancer that you must not ignore. Before we dive in, please subscribe to our channel for more informative videos. Now back to the topic. Number 1. A lump or thickening in the breast or armpit. One of the most well-known early signs of breast cancer is finding a lump or thickening in the breast or underarm area. But here's the catch. Not all lumps are the same. Cancerous lumps are often painless, hard, and have irregular edges. However, they can also be tender or soft in some cases. It's important to note that lumps can form not just in the breast tissue, but also in the lymph nodes under the arm. A lump doesn't always mean cancer. It could be a cyst or a benign condition. However, any lump, thickened area, or persistent swelling in the breast or armpit should be examined by a healthcare provider. Regular self-exams can help you familiarize yourself with the normal texture of your breast tissue, making it easier to spot unusual changes early. Don't ignore this sign. Early detection through self-awareness and prompt medical attention can lead to more effective treatment options. If you feel something that doesn't seem right, schedule a visit with your doctor without delay. 2. A change in the size or shape of the breast. One of the more subtle but critical early signs of breast cancer is a noticeable change in the size or shape of the breast. This change may not always be dramatic. It could be as subtle as one breast appearing slightly larger, fuller, or oddly shaped compared to the other. Sometimes, the contour of the breast might look uneven, or the skin may feel tighter in certain areas. These changes can happen without any visible lumps and are often overlooked. However, they may indicate that something is happening beneath the surface, such as a tumor pressing against or infiltrating the breast tissue. Cancerous growths can distort the natural shape of the breast, leading to asymmetry that wasn't there before. It's important to understand that breast size can naturally fluctuate due to hormonal changes during menstrual cycles, pregnancy, or weight gain. But if you notice a persistent or unexplained difference in the size or shape of one or both breasts, especially if it happens suddenly, it's time to consult your healthcare provider. Early detection is key. By paying close attention to even small gradual changes in your breast's appearance, you can take proactive steps to protect your health. Don't wait. Trust what your body is telling you. 3. Changes to the skin of the breast, such as dimpling. Another early sign of breast cancer that's easy to overlook is changes to the skin of the breast, such as dimpling or puckering. This skin change can resemble the texture of an orange peel, often referred to as peau d'orange. Dimpling happens when cancerous cells disrupt the normal structure of the skin, or when a tumor grows and pulls on the skin's connective tissue, causing a visible indentation. While it may appear subtle at first, dimpling or any alteration in the texture of your skin should be a red flag. Other skin changes could include redness, thickening, or unusual warmth. These changes happen when the tumor affects the skin layers, sometimes causing swelling or inflammation in the breast. If you notice any puckering, dimpling, or a change in the skin's appearance that wasn't there before, it's important not to ignore it. Even if there's no pain or lump, such skin changes can be an indication of underlying breast cancer. Don't wait for the symptoms to worsen. Early diagnosis through a clinical exam or imaging tests, like mammograms, can help you catch potential issues early when treatment is most effective. If you see changes to the skin of your breast, consult with a healthcare professional. 4. A change in the nipple, such as a pulled-in, flattened, or inverted nipple. A change in the nipple is another key sign that should never be ignored. If you notice that your nipple has pulled in or flattened, this could indicate a potential underlying issue. The nipple may also appear inverted, meaning it turns inward instead of pointing outward. This could be a result of a tumor growing near the nipple, causing the surrounding tissue to contract and pull the nipple inward. In some cases, a change in the nipple might be accompanied by redness, scaling, or itching, which could indicate inflammation caused by cancer. A nipple that appears retracted or flattened could be the result of invasive cancer that has spread into nearby tissues, altering the natural position of the nipple. It's essential to pay attention to any new nipple changes that seem unusual or don't return to their normal position. This change may be more difficult to notice in women with larger breasts, so regular self-exams and routine checkups are key. Don't hesitate to reach out to your healthcare provider for an evaluation if you detect any changes. If you notice an inverted or flattened nipple, seeking medical attention promptly can help catch potential cancer at an earlier, more treatable stage. 5. Unusual discharge from the nipple. Unusual discharge from the nipple can be an alarming symptom that should not be dismissed. While some nipple discharge can be normal, especially during pregnancy or breastfeeding, any discharge that occurs without squeezing or pressure, especially if it's clear, bloody, or pus-like, should be taken seriously. In particular, bloody or brownish discharge is a red flag. This type of discharge may be linked to underlying breast cancer or other serious conditions affecting the ducts of the breast. Even if there's no lump associated with the discharge, it's still important to get it evaluated by a healthcare provider. Cancers, especially those in the ducts of the breast, can cause abnormal discharge as they block or alter the normal flow of fluids within the breast tissue. If you experience spontaneous discharge from one or both nipples, make sure to bring it up during your next medical appointment. A clinical examination, along with tests like mammography or ultrasound, can help pinpoint the cause. The earlier abnormal discharge is identified and assessed, the more treatment options are available if cancer is diagnosed. Don't ignore your body's signals. Early intervention can be life-saving. 6. Swelling in the armpit. Swelling in the armpit, also known as axillary swelling, can be a sign of breast cancer, especially if the swelling is on one side and does not go away. The armpit is home to a large number of lymph nodes, which play a critical role in the body's immune system. These nodes can become swollen if cancer cells have spread from the breast tissue to the lymphatic system. In many cases, this swelling is not painful, but it can be noticeable when you feel around your armpit or notice an unexplained lump. Swelling may also feel hard or firm, and the lymph nodes can be swollen without any other visible signs of infection or injury. This type of swelling, especially if it appears suddenly or becomes persistent, should be checked by a doctor, as it could indicate that breast cancer has spread beyond the initial tumor. Even though swollen lymph nodes don't always point to cancer, they can also indicate other medical conditions, such as an infection. However, when it comes to breast cancer, swollen lymph nodes in the armpit area are a serious sign that should prompt further examination. If you notice unexplained swelling, don't wait for symptoms to worsen. Getting checked early gives you the best chance of detecting cancer in its earlier, more treatable stages. Pain in the breast. While many women experience breast pain at some point in their lives, it's essential to be cautious when pain is persistent, unexplained, or occurs in only one breast. Breast pain or mastalgia can be a symptom of many benign conditions, such as hormonal changes. But if the pain is localized to one area and doesn't go away, it could be a sign of something more serious, like breast cancer. The pain associated with cancer is typically deep, persistent, and can feel like aching or tenderness in the breast. It can sometimes radiate outward or be linked to other symptoms, like a lump or skin changes. Unlike the discomfort that often occurs during menstruation, cancer-related pain does not cycle with your menstrual period and doesn't subside with time. If you experience pain that's localized and continuous, especially if it's accompanied by any other unusual symptoms like a lump, skin dimpling, or discharge, it's crucial to have it evaluated by a doctor. Early detection of breast cancer is vital for successful treatment, and pain is one of the key indicators that can prompt a deeper investigation into the health of your breast tissue. 8. Soreness. While soreness in the breast can often be linked to hormonal fluctuations, unexplained and persistent soreness that doesn't go away or is localized to a specific area should raise concern. If the soreness feels different from what you might experience during your menstrual cycle, or if it is present even when you aren't on your period, it could indicate an underlying issue. Cancer can cause soreness when a tumor presses against nearby tissues or nerves in the breast. This localized pain or tenderness is often distinct from the general cyclical soreness that many women experience. The soreness can sometimes be accompanied by other symptoms such as a lump, skin changes, or a pulling sensation in the breast. If you're experiencing persistent soreness that lasts for weeks or feels unusual compared to typical breast discomfort, it's important not to dismiss it. Early detection through a physical examination, imaging tests like a mammogram or a breast ultrasound can help identify whether there is a tumor or other issues present. Don't wait for the pain to escalate. Scheduling an appointment with your healthcare provider can help ensure that any potential concerns are addressed promptly. 9. A red, scaly rash on the nipple. A red, scaly rash on or around the nipple could be one of the more alarming signs of breast cancer, specifically a condition called Paget's disease of the breast. This rare form of cancer affects the skin of the nipple and areola, causing redness, scaling, flaking, and irritation. The rash may also be itchy, painful, or have a crusty appearance. At first glance, this rash can easily be mistaken for other skin conditions, such as eczema or a simple skin irritation. However, when this condition persists or doesn't respond to usual treatments, it could be a sign that there is an underlying cancerous growth in the breast tissue. Paget's disease often occurs in conjunction with an underlying invasive breast cancer or ductal carcinoma. In the early stages, the rash may appear subtle, but it can progress to a more severe condition, including bleeding or discharge from the nipple. If you notice any persistent redness, scaling, or itching on the nipple or areola, it's crucial to have it evaluated by a healthcare provider. While it may not always indicate cancer, it is important to rule out this possibility early on. Catching it early can significantly improve the outcomes of treatment. Your body is constantly sending you signals, and it's important to listen closely. Whether it's a change in the size of your breast, an unusual discharge, or persistent soreness, these early signs could be the key to early breast cancer detection. Don't wait for symptoms to worsen. Take action now and schedule a checkup with your healthcare provider. Early detection could mean the difference between life and death. Share this information with your loved ones because knowledge can truly save lives. Stay informed, stay proactive, and stay healthy.